Taryn Marks works for the Department of Health and coordinates the Closing the Health Gap projects for the Barwon Southwest region, working with communities in Geelong and through to Hayward and Portland. The Aboriginal Health Pathways project was funded through the Closing the Gap workforce initiatives. Taryn's initial scoping for the project was to investigate how best to get young people in the Aboriginal community to engage in health careers. One of the biggest challenges of the project has been to encourage engagement from the Aboriginal community.
After interviewing and meeting a lot of people in the sector, in the Aboriginal community controlled organisation, the TAFE and other education and training providers or people in the education sector, we determined that engagement was going to be the critical piece of work to do. And Anne-Marie, Ryan, I had met through some of the other departmental work, and we determined that the LEN was well positioned to be able to deliver the outcomes that we were looking for.
Lindy Dietzel is the Aboriginal Health Programs Liaison Officer at Barwon Medicare Local. Her role there is to assist the uptake of the Indigenous Health Incentive Program within general practice in the region, assisting GPs to work more effectively and culturally safely with Aboriginal and Torres Strait Islander patients.
I think there's a lack of real robust relationships between mainstream services and organisations and the local Aboriginal community, and that the more work we put into creating those relationships and building those, the more successful we're going to be.
Despite these difficulties, some strategies have proven effective in encouraging engagement.
I think there's been things like hospitality, barista training that has started to get the engagement of some really at-risk people, as well as getting people that haven't been in the work environment for some years, Aboriginal mothers or mature-aged people. I think it's this engagement in these type of areas that they're showing people that you can learn and be educated, but with a fun element to it. Obviously from there you'd like to see that continued engagement, and I think that that's really about a bit of creativity.
When I first started in the role at Medicare Local, we looked to creating some promotional material, for example brochures and posters, and we decided that it would be much more beneficial to really link with community in terms of developing those resources. So we launched an art competition, and as a result got some beautiful artwork that we used as branding for the whole project, and that in itself was quite successful, and went on further to one of the paintings that actually didn't win the prize was used as the branding for a health forum that was held here earlier this year.
I think with this particular project we had to really backtrack and think about health pathways as the secondary objective, and that the primary objective was about engagement, and I feel really pleased to have been able to continue to advocate that to the education and training providers, to the community, to my senior colleagues, particularly at the Department of Health in Melbourne, that we can't just put Aboriginal people straight in the forefront of a health course or pathway, that engagement initially is really challenging when we're talking about young people that may not have had role models with their education. They may be at risk. We've had to really backtrack that, and I feel really pleased that we've slowed our processes because of that, and are now starting to see the fruits and the reasons why we did that.
So what has been learnt so far, and what should be the future of the project?
So what started out as a group that was more sort of task focused, we now have a network of Aboriginal workers across the region in all different sectors, people that are representing not just themselves but their organisation and bringing all those resources to the table. So it has now become a network where information is shared, where little projects or tasks can grow and start up. It's been a great way for different members of community to come together that may not have worked together in the past. And I suppose one of the biggest lessons for the LEN and myself as the chair was to really communicate very honestly about the need at times to pull back and not actually be caught into desired deadlines that unfortunately we all live with, and that Anne-Marie was very patient and understanding of the need to just put the brakes on and cool our jets from time to time.
We're quite unique in that some of those networks have been long established and it's made the work a little easier. We've still got a lot to do, but I think there's lots to learn from this project for other areas that are probably at the stage where they need to form those networks. I think there's something to learn in the way that Anne-Marie has kept persevering to continue this line of work. She's done it with good reason, but with extreme patience.
For further information on this project, Dyeemboorrma Lola Booyt, Aim to Health and Wellbeing, contact the project manager Jasmine Kildea via the Geelong Region Local Learning and Employment Network, www.grllen.com.au.